Hello, everyone. Welcome back to 3 News Now. I'm Stephanie Haney. It's Monday, October 19th. I've got your top headlines for you from WKYC.com and our WKYC app. Thanks for choosing to be here to get filled in on what's impacting you here in Northeast Ohio. We have a breaking news update from Governor Mike DeWine, who just spoke to Ohioans from Burke Lakefront Airport here in Cleveland, talking about the importance of wearing masks right now while cases of COVID-19 continue to surge here in Ohio. Governor Mike DeWine said that he would be traveling around the state to talk to people directly and try and impress upon them the importance of wearing masks right now to stop the spread of COVID-19. He said he's not asking people to stop their lives, but he is asking people to live differently right now. Governor Mike DeWine today said in rural counties specifically, we're not seeing mask wearing as high here in Ohio, and we would really like to get it up. DeWine said today, if we could get 85% of the people who are out in public to wear a mask in the state, that's what we're going to have to do as we go through this, and it's going to make all the difference in the world in terms of what COVID-19 looks like here in Ohio over the next several months. He also had comments about the economy. He said, a huge surge upward that we're starting to see is going to do nothing good for the economy. It's going to slow things down. DeWine said we're already starting to see that in some communities in Ohio where the virus has risen up. He also talked about the possibility of more schools having to go completely remote in Ohio because of increasing COVID-19 cases. Today, DeWine said teachers have gotten sick, students have been quarantined, and schools have had to pull back and go remote. We can fight this. We have a common enemy. The enemy is the virus. We can keep this virus down, but we just all have to pull together in order to do it. Now, as a reminder, there have been multiple Northeast Ohio schools that have already been impacted by COVID-19 just in the past month. Those schools include Mayfield High School, Willoughby East Lake, Bay Village, and Lake Catholic High School. And it's not just the education for K through 12 that's been impacted by this. Higher education has also been impacted. Kent State University has had to quarantine hundreds of students over the past several weeks. Now, all of this is happening, this message from Governor Mike DeWine today in an unscheduled press conference, coming after last week, Cuyahoga County and Summit County were each upgraded to level 3 coronavirus risk level. That is under the state's new public advisory system that Governor Mike DeWine unveiled over the summer. As a reminder, that level 3, that red level, indicates very high exposure and spread of COVID-19. Purple, level 4, is the highest level. Now, as of Thursday, when those designations are updated each week, 29 of Ohio's 88 counties were labeled as red, with those counties accounting for 65% of the population of the state of Ohio. Now, what Governor Mike DeWine had to say about the mask mandate, which went into effect over the past several months, is that if the mask mandate is not followed here in Ohio, the state may have to consider even stricter measures in order to help decrease COVID-19 spreading in Ohio, as we have seen those cases going up over the past week. Governor Mike DeWine said, this is a time when truly people control, citizens control what the next 3 months will look like. While everyone is very concerned about what will be happening, medical professionals very concerned about what will be happening as we move into flu season, which also hospitalizes people and creates some concern over the availability of hospital beds and, of course, what happens after hospitalizations. Medical experts very concerned about a rise in hospitalizations because that tends to trend into a rise in deaths. Now, we have the latest numbers in from the Ohio Department of Health related to COVID-19 here in Ohio. New daily reported cases are up from yesterday. Deaths are in single digits reported for the last 24 hours, and hospitalizations are up again from yesterday. So over the past 24 hours, there have been 1,837 new reported cases of COVID-19 in Ohio. In the last week, there were several days when there were over 2,000 new daily reported cases here in the state of Ohio, with multiple of those days setting a record day after day at last week for the highest 24-hour new daily reported number of cases since the pandemic began here in Ohio, which dates back to March 9th. Now, the total number of cases right now that have been reported dating back to March 9th in Ohio is 183,624. And our average 7-day testing positivity rate is now at 4.7%, just under that World Health Organization recommended threshold of 5%, which is something that over the past several weeks we had been well below, often in the 2% range. So again, that's now up to 4.7% for all of those COVID-19 cases that are being done, 4.7% on average over the last 7 days coming back positive. Now, last week, Ohio did break the barrier of 5,000 reported deaths related to COVID-19. That total is now 5,075, with 8 new deaths reported in the last 24 hours. Yesterday on Sunday, there were 0 new deaths reported. And in the last 24 hours, there are now 111 new hospitalizations. The total number of people hospitalized here in Ohio with COVID-19 is almost at 1,100. That number is 1,097. And 289 of those people are currently being treated in the intensive care unit. So that's about 26% of people in Ohio being treated for COVID-19 that are requiring treatment in the ICU, with 14 new ICU admissions in the last 24 hours. Now, our hospital bed occupancy rate is just about 69%. That is down a few percentage points from Sunday. So that means right now 31% of our hospital beds are available for people who do need treatment here in Ohio. Now let's take a look at the national and global numbers for COVID-19. Early this morning, according to Johns Hopkins University, the global total number of COVID-19 cases passed 40 million. Now that was this morning. So the global number of cases right now, the most up-to-date number from Johns Hopkins University, is now 250,000 over that. That number is 40,240,700. So since breaking that 40 million barrier early this morning, another 240,700 global cases of COVID-19 have been reported. And the total number of deaths at the global level for COVID-19 is now at 1,115,907. Now, bringing it back here to the U.S., where we have about 4% of the global population, we have about 20% of the cases and the deaths related to COVID-19. Those numbers for cases in the U.S. at 8,177,148, and the number of deaths related to COVID-19 in the U.S. is now at 219,880. Now, as we look at cases that continue to rise across the U.S., you might have seen on social media this graph that says that it's tracking COVID-19 cases by state and also flags those states by their partisan affiliation, meaning how likely voters are to vote a certain way in those states dating back to June. So our Verify team took a look at this. They wanted to see if the data is accurate according to other sources, according to what the state's actual political leanings are, and also if the COVID-19 data is correct. So here's what our Verify team came up with. The graph was created by a person named Dan Goodspeed. This is a web developer who runs his own website and his own blog. He's created multiple of these COVID-19 visualization charts. Now, particularly for the data related to COVID-19, our Verify team learned that Goodspeed used COVID-19 data that's been compiled by the New York Times and is pretty close to real-time data. So the New York Times says this data comes from dozens of journalists working across several time zones to monitor news conferences, analyze data releases, and seek clarification from public officials on how they categorize cases of COVID-19 across the U.S., and it's based on reports from local and state health agencies. Now, it's not exactly in line with the data that's available for the Centers for Disease Control and Prevention, but it is fairly similar to that data. Now, in terms of the political data on this graph, Godspeed says that he uses the Cook Partisan Voting Index to determine the political leaning of each state. So what the Cook PVI does is it estimates how much more Republican or Democrat a particular state is than the national average, and this is based on recent voting patterns. This is not necessarily based on who is currently in power. So if there is potentially a Democratic governor of a state, that wouldn't necessarily mean that that state would be labeled blue on Godspeed's chart. Another question our verifying team looked into: why did the data start June 1st? Well, here's what Godspeed had to say about that. He said that June 1st was around the time that countries worldwide that had really been hit hard by the pandemic had the opportunity at that point to apply proven preventative measures related to COVID-19. So basically, what Godspeed is arguing here is that scientists worldwide had determined by June 1st the best way to slow the spread of COVID-19. And so differences in that total cases by that point are newsworthy, according to Godspeed. He said he does plan on making a similar chart showing partisanship of states and death counts, and that will be coming shortly. He does have these charts available on his blog. We've got those linked on WKYC.com and the WKYC app. Again, this is all about that bar chart that shows states and their political leanings and how the cases of COVID-19 have changed. If you look at the chart, what it tends to show, according to Godspeed's data, is that states that lean to the right, that are more heavily Republican, have seen a bigger increase in COVID-19 cases since June 1st. Now we have an update for you on Emma Pfouts and her recovery. This is the Norton teen who collapsed during her homecoming dance after a severe asthma attack. Her family, we are now 1 year out from that incident happening, and her family says she's definitely come a long way. She's got a long way to go, but she's making progress, and her positive attitude has really been everything, and they truly believe that the sky is the limit for Emma, so she's going to keep trying until she gets to where she wants to be. Her family says that she keeps undergoing treatment, therapy every day with several goals in mind. She wants to be able to walk, return to school, and be able to drive. So those are the forces that are driving Emma right now as she undergoes her therapy. We'll be continuing to follow her story, but we do have the latest for her up on WKYC.com. And of course, you can find that in our WKYC app. Here's one thing to let you know about before we go here. There is a new job available. It's just for one lucky person, but it pays pretty well, and it's a pretty sweet deal. This is a Halloween candy testing position. This is from Finder Media. They're asking for submissions. They're taking submissions through Monday, October 28th, and they're going to be announcing the person chosen to be their Halloween candy taste tester to determine the very best Halloween candy. They'll be announcing the lucky person who's selected on Wednesday, October 28th. Now, this is open to residents of the U.S. and Canada, and you do have to be 21 years of age or older, but some of the things that you'll have to be prepared to judge the candy on include the candy taste, the price of the candy, the size of the candy, if it makes your jaw hurt when you eat it. So we're thinking maybe jawbreakers there, or maybe if you like to bite on a blow pop or those kinds of things, maybe some taffy that's particularly sticky that makes your jaw stick together and you've got to do a lot of chomping. And also healthiness. That's a good factor to throw in there. So if you're looking for work and you like sweet treats, that's definitely something for you to check out. This is something that's being offered by Finder Media. That's it for your 3 News Now afternoon update for Monday, October 19th. I'll see you next up on What's New with your trending stories in the Clicking in Cleveland segment. You can stream that live for free in the WKYC app. Just open up the app, click on Watch, and you'll be able to see that live, just like you can do with any of our other broadcasts. And I'll see you back here tomorrow for 3 News Now. And if you are listening to 3 News Now as a podcast, please take the time to subscribe, rate, and review the podcast. And if you're not doing it yet, you can find 3 News Now on your favorite podcast provider by just searching 3 News Now with Stephanie Haney. That's the number 3, and there's no space between 3 and news. Again, that's 3 News Now with Stephanie Haney. Just search for it on your favorite podcast platform, and you'll be able to get this that way. I'll see you back here tomorrow. I'm Stephanie Haney.